Mga katribu, itong episode po ay tungkol sa stem cells. Alam po nating lahat na ating katawan ay gumagawa ng stem cell. Pero bakit kaya may bagong therapy na siyang makakatulong sa ating kalusugan at kalakasan? At syempre ang ating bata. Okay, let's ask Dr. Meddie Edodollon. Doc Med, bakit kailangan magkaroon ng stem cell therapy? At ang stem cell therapy ba ay para sa lahat?
Ang stem cell therapy, ito po yung ginagawa natin para sa mga pasyenteng usually nakaroon po ng problema sa degenerative diseases o may mga tinatawag po na mga sa organ system. Stem cell therapy, ibigay po yan cuero, intravenous injection, or pwede po ilagay po na direct injection. Kung sila karoon po. Ang stem cell therapy, ito po yung tinutukoy po natin ng mga nakaraang dekada na therapy of the future. Well, stem cell therapy na andito na po, dumating na po yung ating hinaharap on our future is today. So we are very lucky to feature and launch it through Kintaro stem cell.
Ayan mga katribu, alamin po natin kung ano ba talaga ang ibig sabihin ng Kintaro cells power. What exactly is the nature of these stem cells and where do they come from? Let's hear it from the owner herself. Well, it's a family-owned corporation and please welcome Tatiana, my good friend. Hi Tatiana.
Hello. Hello, everyone. Thank you very much for inviting me.
And welcome to Manila, Tatiana.
Thank you.
Tell us about Kintaro Cells Power. And it's a very nice story that you were telling me earlier. So please share with our televiewers how you came about stem cell therapy from Russia and why you're here in the Philippines today.
Always very happy to come to Manila. One of my favorite city. So good welcome always. Thank you very much. The story is quite simple, but it's very life story. So my mother and my father discovered stem cells together. My mother is a doctor, and my father coincidentally find that he has the heart failure and some side of psoriasis. The condition was very bad. And he started to look for the proper treatment for him. So he searched and he find that its only way to fix his heart failure is the surgery. He was not agree with this. And suddenly he remembered that one of his friends, his good friends that based in Moscow in Russia, is a professor. He is the stem cells professor. So he comes to him and asks for help. And of course, the doctors say you must try this alternative way of treatment, so-called mesenchymal stem cells derived from the bone marrow. For many parts of the world, the stem cells is quite new technology, but for the USSR people, for the USSR doctors, for the medical society and University of Russia, this is not a new treatment. We developed this over the decades, and the first treatment has been done in 1959. So it has a long and proven in the safety and the quality history for the stem cells. And my father said, of course, let's try it. So his first treatment has been done, and after third treatment of the mesenchymal stem cells, he feels so much better, he feels so energetic, he feels healthy.
Okay, Tatiana, can I ask you, with the mesenchymal stem cells that your father had, and they came from him, was it autologous? It came from his own bone marrow, or did you have to source it somewhere else?
Very good question. Yes, the stem cells is two types, autologous and allogenic. mesenchymal stem cells derived from the bone marrow that he has been done is not from him. It's not autologous, it's allogenic. And it's proven that the allogenic bone marrow mesenchymal stem cells work 70% better than your own stem cells. Yes,
Interesting.
It's not only from some donors, and this is very important to know that the donors is properly, fully screened before you can be a bone marrow donors, and the donors very young, from 18 to 24 years old.
So that is the age range, 18 to 24.
Yes.
And do you find that you have an unlimited, well, almost unlimited and good source of these stem cells? Is it all from Russia or is this from Japan?
Well, Kintaro Cells Power Corporation has been developed around 11 years ago, and the headquarters base in Tokyo, in Japan. And the owner is Mr. Alexei, is my father. So, of course, the source for beginning was only from the Moscow, from Russia. It's so-called a bank. Yes, but if we're talking about nowadays, now, the company is growing and developing, and we have, of course, our bank in Japan. So our patient in Southeast Asia, Philippines, for example, Thailand, Malaysia, Indonesia, can get a proper treatment that has been delivered from Japan.
But the stem cells themselves, the actual source, are from Russia.
The actual source, we have two sources, one is in Russia and one in Japan. Depends on the logistic, how easy to deliver. It will be delivered, for example, from Japan.
So there is a stem cell bank in Japan, am I correct?
Yes.
Also one in Russia?
Yes.
And then the source of these stem cells are from Russian donors or Japanese donors? Both.
So I have to clarify a little bit. So the source, and in particular mesenchymal stem cells derived from the bone marrow, do not have a matching effect, or you don't have to match a nationality or ethnic of the donors to the patients. It meaning that the procedure can be done, for example, the donors is Japanese, but the patient is in Thailand. Not a problem, because the bone marrow cells, or mesenchyma, it's where the bone marrow cells have been derived, do not have any matching components. You have to match.
So I see. You answered my next question already, because I was going to ask you, do you have to match the donor with the recipient? No. So you say that the procedure is so easy to do, and you'd like to introduce this to the Philippines.
Yes, we will be happy to introduce this to the Philippines.
And then you have an alliance with the HICC.
Yes, we have alliance with HICC. We are in partnership and very happy to collaborate with HICC on the regenerative medicine.
This is exciting because not everyone wants to go under the knife. When the doctor says to the patient, it's a must, but that stem cell therapy has been proven to be quite effective in helping people regain their health and their vitality. And I'm so happy that Kintaro, I was going to ask you, why Kintaro? Why did you choose that name?
Amazing question. Amazing question. Because the Kintaro is a very well-known Japanese folklore creature. It's a Kintaro golden boy. This is my pin in here. Maybe it's a little bit small to see, but this one is a Kintaro boy. It's our a mascot. Yes. Yes. So Kintaro golden boy is in Japanese history already many hundreds years. And the Kintaro golden boy represent health and represent everlasting healthy life. So Kintaro Cells Power, it's actually come from the Kintaro golden boy. So
Oh, that's so exciting. Oh, I would really like to be supercharged like a Kintaro golden girl.
Yes, yes, yes. We have a female stem cells and the male.
So, Tatiana, for patients who would like to avail of this stem cell therapy, wow, Kintaro, all they have to do is just go to HICC.
Yes, yes. You have to go to the HICC. It will be a proper doctor screen checkup. So have to do a full blood checkup before we go into the procedure.
Mm-hmm.
And after that, we just schedule treatment. And that's it. The treatment is pretty easy. It's about half an hour to 40 minutes.
Mm-hmm.
Patient free to go home.
Is there a follow-up treatment?
Yes, it's a follow-up treatment. So again, if we go back to the history of mesenchymal stem cells or marrow stem cells, to recommended dose is 200 million cells first time, and you have to do for good result 3 to 5 times.
3 to 5 times. So when you sign up with HICC, you sign up for the entire package.
Well, it depends on the patient condition. Yes. Sometimes patient condition is quite light, and we have many patients who come just require, for example, good immune system, anti-aging effect, some rejuvenation, immune support. So for this purpose, you can only do, for example, twice a year or 3 times a year, and the follow-up. And if the patient is sick, or we usually call it a complex of the illness, a bouquet of the disease, unfortunately. So in this case, depends on the doctor examination and the blood test and some other screens. So we recommend, the doctor recommends in HICC to do, for example, 5 times per year or even more. So it's always depends on the patient condition.
Mm-hmm. I know that, Tatiana, that you work closely with the University of Tokyo.
Yes, we have a several collaboration with the different universities in Japan, also with University in Okinawa and Kyushu, and we also have a collaboration, already long collaboration with Tokyo Medical University, tissue engineering.
Tissue engineering, this sounds so exciting. Tatiana, but you were saying that the Kintaro stem cell therapy is intravenous, correct? It's IV.
Yes, correct.
Have you thought about its application for aesthetics? Is there any way that you can harness or harvest these stem cells for topical treatments?
Well, it's possible, yes. Stem cells provenly work better and longer for the prolonged effect if you do through the IV injection.
Okay.
Yes, but of course we have a several amount of the patients who is require something more, something on top of this. Yes, the local injection in the small amount of cells, so for example 50 million of cells, could be done on top of the IV injection. Means, for example, locally, if you talk about some injury, sports injury, so it could be done in the elbow, neck, back, and if you talk about anti-aging, so yes, it could be done to the face or neck.
I see. Tatiana, is there anything else you'd like to add? Because you explained it so well, so calmly, and we all want to sign up for our Kintaro Cells Power Therapy.
Thank you very much. So if it's any questions, so I think the patients or people who are interested can go to the HICC. It's a question about the mesenchymal stem cells from on.
Thank you so much, Tatiana.
Thank you very much.
Mga katribo,
Thank you.
ating napakagandang kaibigan na si Tatiana. She explained the importance of stem cells and how safe the procedure is with HICC. So let's go back to Dr. Meddie Edodollon of HICC. Now, Ben, yung stem cell therapy na galing sa HICC na Kintaro stem cells, feel immediate effect right after the
Stem cell therapies work overtime po. So, hindi po ito something na after injection and infusion, kakaramdam na po ginagawa. Alalahanin po natin itong stem cells natin is mga baby stem cells na ang functions niya mararanasan lang natin kapag sila o gumawa na sila ng bagong kidney, gagawa na sila ng bagong hearts, tumutulong na sila pabatain ulit yung mga ibang areas ng ating pangangatawan. So, yung ating stem cells, paano po tayong tinatawag one session, because most of the time kailangan. So, stem cell therapies, meron po tayong observation. So, chine-check natin. Minomonitor natin yung mga patients through 1 to the day of infusion up until sa isang taon po after mag-infuse. Most commonly, through time, nakikita na po natin ebidensya kung saan po effective. Kasi nakikita po natin ito na ganda ng kanila. So, kapag sa pasyente problema. So, pag meron naman po silang mga problema sa buto-buto, nagkakaroon ng pinakamataas na regenerative capacity ng kanilang katawan through stem cell therapy.
ang sinasabi ng pasyente nyo pagkatapos ng stem cell therapy. First thing they tell you,
Full stem cell therapies. It's really a world-class type of stem cell therapy, and it's one of a kind kasi po, hindi po lahat ng pasyente okay po sila for stem cell therapy. Once na nakita po natin na properly screened na yung patients, kita na natin yung pasyente, they are very thankful to have encountered us to take into care and also to be able to have the therapy kasi it's really world-class, state-of-the-art, and the highest regenerative potentials for the patient.
Yan ang gusto natin. Regenerative, yan ang operative word, mga katribo, dahil we want to live longer but with more vital. May nagsabi, Dr. Meddie, na pwede po tayong gumawa ng natural stem cells sa healthy lifestyle sa pamamagitan ng isang healthy lifestyle. What's your opinion?
Beyond that, because first, the body, they increase or they can actually be activated. One, by healthy diet, by great exercise, whenever we our body, mas tumataas. And when we do some supplementations, tumataas yung ating status sa pangangatawan. When we take care of our body, mas lumalabas nating kabataan ng youth. Mas bumabata tayo because our steps
It show in your aura, gaganda ba din ang kutis?
ay therapy. Some side effect of therapy is yung healthy glowing. Side effect na lang po yun, hindi na nga yan yung primary effect ng stem cell therapy.
Yung mga wrinkles, Dr. Ahmed.
Ay, yes. Po yung ating at nagkakaroon ng rejuvenation at nawawala po yung mga wrinkles ng ating.
Ahmed, would you like to invite everyone sa HICC consultation tungkol sa Kintaro stem cell therapy?
Nanood ng ating mga tribu, pwede care para po mga katanungan and if you like comprehensive consultations, and if you're interested for Kintaro stem cells, if you're interested for Kintaro stem cell therapy, tara po, usap po tayo. Magagawa po tayo ng magandang plano, i-check po natin if you're great candidates for Kintaro stem cell therapy.
Yung initial consultation, libre po yun?
Po, ilibre po natin sa lahat ng ating mga katribo. Ilibre po natin ang initial consultations natin sa mga tagapanood po natin. Banggitin niyo lang po ang pangalan ni Miss Cory. Ako, napakalakas. Yes po, opo. Magandang umaga po sa ating lahat. Miss Cory, lahat po ng ating mga patients nakapat po itong ating daily feature. Banggitin niyo lang po ang pangalan ni Miss Cory. Nako, libre na po kayo for consultation.
Marami pong salamat, Doc Meddie Edodollon ng HI.
Daily Tribune may digital shows na din. Dahil sa mas lumalaki at mas lumalakas nating tribu, handog sa inyo ng Daily Tribune ang mga programang magbibigay buhay araw-araw. Be informed at mag-good vibes tuwing umaga sa programang Gising Na. Be updated sa news and happenings sa Tribune News on Cue. Mas kilalanin pa natin ang mga paborito nyong atleta sa programang The Athletes Tribune. Alamin ang latest entertainment sa programang What's Up. Ma-inspire sa mga kwentong hatid ng Perfect. Search lang ang Daily Tribune sa inyong Facebook at Tribune Now on YouTube. See you there, mga katribu!